quantitative article critique, interaction of healthcare worker hands and portable medical equipment, a sequence analysis to show potential transmission opportunities. Created by Thomas Atkins, Ashley Carden, Sarah Gish, and Ashley Spell.
Why was the study done? Was there a clear research question or hypothesis? What is the role portable medical equipment plays in the transmission cycle of healthcare-acquired infections? Was there a clear explanation of the purpose of the study, and if so, what was it? The purpose of the study was to investigate the patterns and sequence of touch events among healthcare workers, patients, surfaces, and equipment in the hospital environment to better inform our understanding of potential infection transmission pathways.
What is the sample size? How many participants were recruited? What did the sample look like? The study was conducted on a 120-bed Veterans Affairs hospital in Temple, Texas on 6 inpatient units. No demographic layout was given in the article. Were there enough people in the study to establish that the findings did not occur by chance? The article did not provide the exact number of people used in the study. There were 274 sequences that were analyzed over the span of 144 hours of observation.
Valid and reliable. How were the variables defined? The variables of the study were defined as the following: frequently touched surfaces, infection prevention activities, network plots, sequence analysis, and bioburden estimates. The sequence analysis consisted of the instances in which the colony forming units were spread by healthcare workers, interaction with surfaces, equipment, and patients.
Were the instruments designed to measure a concept valid? Did they measure what the researchers said they measured? Yes. The sampling was performed using contact Rodak plates on the flat table surface and the handrail of the computer on wheels, or the COW, as well as the scanner used for the medication administration system. The surface area for aerobic bacterial colonies, or ABC, was 25 centimeters squared, and for MRSA was 75 centimeters squared.
Were the instruments used by researchers reliable? Did they measure a concept the same way every time they were used? Yes, the average number of touches per encounter was calculated for each surface type and inpatient unit. Sequences were also separated by whether hand hygiene, glove or hand sanitization occurred, yes or no, and by room access, upon room entry, during the sequence, or upon room exit.
How were the data analyzed? What statistics were used to determine if the purpose of the study was achieved? The average count for aerobic bacterial colonies, or ABC, was 31 colony-forming units, or CFUs, per 25 centimeters squared. The handrail of the computer on wheels, or COW, was more contaminated than the scanner of the table portion of the COW. The medical oncology ward had the highest. 5 out of 48 cows, or 10.4%, had MRSA. MRSA was found on the table of 1 cow with 2 CFUs, on the rail of 3 cows with a total of 5 CFUs, and on the scanner of 1 cow for a total of 1 CFU.
Sequence analysis. Sequence analysis was performed to analyze the order in which the objects, patients, and surfaces were touched. The analysis might provide an insight into common sources of transmission and prevention possibilities. Most common subsequence was touching the patient, then the bed rail. It was 28.1% of all sequences. Second most common subsequence was touching the bed rail, then the patient. The next two most common subsequences overall involved PME. Touching the cow and then the patient was the most common subsequence between PME and patient. 22.6 of all sequences contained this subsequence. 14 of the 20 most commonly occurring subsequences involved touching the patient, 8 involved PME, and 8 involved a surface on the bed. Hand sanitization and/or glove use occurred in 4 of the 20 most commonly occurring subsequences.
Unusual events? Did people leave the study, and if so, was there something special about them? No. Even though the healthcare workers were aware they were being monitored for behavior, all agreed to observation and were comfortable with carrying out their routines as they normally would. There were also no instances that were mentioned whether or not patients themselves had left during the observation period, so there were no unusual events as far as the patient population is concerned.
How did the results fit with the previous research in the area? Did the researchers base their work on a thorough literature review? The researchers used a total of 22 references for the study, one of which is a major infection publication known as Journal of Hospital Infections. This is a peer-reviewed medical journal and was referenced numerous times throughout the article.
What does this research mean for clinical practice? Is the study purpose an important clinical issue? It is a very important clinical issue as this study deals with the clinical setting exclusively. Will the results actually help clinicians care for patients? The results should show that there is still not enough hand hygiene and disinfection happening on a regular basis to limit the spread of bacteria and germs between patients. Even when the participants were aware they were being observed, healthcare workers still failed to hold the hand hygiene standards that are supposed to be fulfilled in the hospital.